If you're giving birth soon, are you wondering what to put in your hospital bag? Today, we're going to go through everything that is absolutely essential that has to go in your hospital bag. We are going to cover the 10 most essential items that I found in every single blog post, Reddit post, OBGYN, doula, midwife recommendation that I could find. I went through every single resource possible. There's so many hospital bag checklists that go on and on and on. But today we're just going to go through the 10 most essential items that was on every single list that I found. So, number one, you're going to need a nursing bra. I got this nursing bra off of Amazon. It was really inexpensive and the material is really soft. So, this is really good right after birth because your breasts will be engorged. So, you want to make sure that you have proper support. It's more comfortable than regular bras. It also is good for skin sensitivity right after birth. And lastly, you want to have support while you're breastfeeding. As you know, immediately after birth, generally you breastfeed. So, you want to be able to have a bra that supports that. So, this is a bra that you wear, and then it essentially has this little clasp at the top that you can undo so that you can unwrap this flap so that you can very easily be able to breastfeed while still keeping your bra on and to provide support for when you're not breastfeeding. Really soft, really absorbent in case you leak. So, that is a really important thing to bring in your hospital bag. Every single blog post and Reddit post that I read said that you want to bring a really, really long charging cable for all of your items, for your computer. So, you don't want a flimsy little one like this. You want a really, really long, nice one like this, or even longer that is going to be able to extend to the outlets because in your hospital room, the outlets are in random places and you want to be able to make sure that you can access your phone, have everything charged up in case you need to, for instance, place a pickup with Anja Health to pick up your cord blood banking kit. So you want to make sure that your phone is always charged and accessible because when you're in bed and such, you just want to make sure that you have things that you want to be able to do that's accessible to you. For instance, I know a mom that was actually on the Anja Health podcast, Elizabeth Yin, who is also an Anja Health investor. She talks about the fact that she played Tetris while preparing for birth while she was literally in labor. And she felt like that was the best way to pass the time. And fun fact, playing Tetris for 10 to 40 minutes a day has been clinically shown to reduce the effects of trauma. So, playing Tetris is a really good way to pass the time if you are giving birth soon. And that is why you need a long cord to be able to play Tetris on your phone. Third most essential item for your hospital bag is a power bank. This is my go to charger. It has a phone cable and also a USB-C cable, and also is able to plug into the wall. So it's not a very long power bank by any means, but you can definitely plug other wires into it here and be able to charge anything. So, like I said, because outlets are kind of in random places in your hospital room, you want to make sure that you can charge everything and anything that you want to. Next most essential item is a water bottle. Obviously, you can get water at the hospital, but a lot of parents and people in general just like to have their Stanley cups and whatever really, really big water bottle they like to have normally, like your emotional support water bottle, ESWB. So I would recommend bringing that. Next is snacks. You want to make sure that you have any snacks available that you can, especially if you're like Jason Kelsey, for instance, where you're chilling at your baby's birth. You want to make sure that you have a lot of snacks to keep you fed and happy so that you can prepare for birth. And this would be for anyone that would be in the birth room. Next, you want to make sure that you have chapstick. A lot of people put in every single Reddit post that I read that you want to bring chapstick to the hospital room because a lot of hospital environments are very dry. They tend to be very cold. And if you are, for instance, like Pookie that just gave birth, you want to be able to do your glam before you give birth for all the photos. Then you want to make sure that you have your chapstick and friendly glam materials readily available. Next, you want to make sure that you have your eye mask with you at birth. An eye mask is something that is really important if you are trying to sleep in a hospital setting. A lot of hospitals have really bright lights and they pretty much don't ever turn off the lights because even if you turn off the lights, all of the little machines and buzzers and sensors and things that are monitoring you and your baby's health will have little lights. So you want to make sure that you can block out the light and maybe even earplugs or anything else that you think might help you sleep better. For instance, for me, when I am personally needing to be able to sleep, I wear an eye mask and then I also wear my AirPods Maxes that are noise canceling. I cancel out the noise and then I play a really, really loud rain sound as a form of white noise to be able to sleep. So that's how I personally sleep in almost any environment. Then you want to have your toiletry bag with you. Your toiletry bag should have your toothbrush, toothpaste, etc., even skincare, anything that you like to have as an overnight bag because you are essentially most likely going to be spending at least one night in the hospital to give birth. So you want to make sure that you have all of your toiletries with you. Then you want to have slippers with you as well because a lot of hospital environments don't really have a lot of comfortable clothing for you. So you can potentially bring your own. I personally just like to have really thick socks on. So you could just wear socks in place of slippers, but you can also bring your best and most comfy slippers with you to birth. Next, you should make sure that you have an Anja Health kit with you at birth. An Anja Health kit contains all of the materials that you need to be able to collect your umbilical cord and placenta stem cells at birth. So essentially, you bring the kit with you. Physicians will be familiar with it and they have done collection before. Then, after you give birth to the baby, the umbilical cord is attached. The placenta is also birthed, typically about 30 minutes after the baby is born. And then your provider will be able to help you insert a cord blood bag needle into the cord vein, collect cord blood, which is really rich with stem cells. And then afterwards, they'll be able to cut off inches of the cord, place it in a small jar, and then place the placenta into another jar. Then you can have a partner or family member call the Anja Health courier service or place a pickup through your portal through a form. A courier can come pick up your kit and then bring it to the Anja Health lab, where your stem cells will be processed and frozen specifically from your umbilical cord and placenta to be able to use for potential future disease treatment. Quick little plug that this is indeed compatible with delayed cord clamping. You can do up to 2 minutes of delayed cord clamping and still bank the rest of the cord blood. If you want to do more than 2 minutes of delayed cord clamping, then you can just bank the cord tissue, which is the cord itself, and the placenta separately. However, most OBGYNs recommend only 30 to 60 seconds of delayed cord clamping. So the 2 minutes does indeed fall well within that window, and you can do delayed cord clamping and bank cord blood. And then you can have stem cells from the umbilical cord and placenta in order to use for future disease treatment. It is most commonly used for cancers like leukemias and lymphomas, but it has also been used for heart disease, liver disease, and there is early research looking at autism, type 1 diabetes, HIV, and so many more. So you never know what could happen. I personally always wish that my family had saved stem cells at birth because my younger brother needed it when he was diagnosed with cerebral palsy, and we did not, unfortunately, have stem cells. So the Anja Health Kit is something that I urge you to have at birth because I think it is an absolute essential as all the other items that I mentioned. And if you'd like to get the Anja Health Kit, you can at the link in the description, but you can also get it at anjahealth.com. Next, I wanted to go through some of the items that are typically provided at the hospital because a lot of people bring everything that they can, especially if it's their first birth, but you never know what the hospital might already have. So I'm going to read off this list of things that I found that the average hospital will indeed have. Number one is a hospital gown. So they will provide this for labor and postpartum, but you can also bring your own robe if you'd like to be able to make things extra comfortable. They also typically have disposable underwear and heavy duty pads specifically for postpartum bleeding. So you don't need to bring those. They also provide a peri bottle, which is to clean your area post birth. So you don't necessarily need to bring those. A lot of blankets and pillows are provided, but typically not the best. So you may want to have your trusty pregnancy pillow with you, although this is, of course, a little bit harder to bring to the hospital. But, beauty is pain. Next, hospitals and birth centers typically also have a lot of baby essentials, things like diapers, wipes, blankets, and often even a going home outfit. So you don't necessarily need to bring that, but of course, a lot of people like to glam out and have a really nice going home outfit for the baby. They also typically have heat packs to provide pain management and support, especially for postpartum cramps. There's also medication for pain relief, and there are some postpartum supplies like birthing balls, balls, and tools like grab bars to support different labor positions. But sometimes people do indeed also bring in their own yoga balls and such. Hospitals typically also provide breastfeeding supplies for lactation support. A lot of hospitals provide lactation consultants and breast pumps as well. And additional items that are often used at birth that you could keep in mind that hospitals do not provide is entertainment devices. So things like your iPad or books to pass the time, going home outfits for you and not your baby, and also anything that your partner or other family members might need at birth. You can make sure that your hospital has all of these items, by doing a hospital tour. Typically, a lot of parents do like to tour the hospital that they're giving birth at beforehand. So you can ask your provider about this as an option. But in general, it is good to consult with your provider when you're thinking about what to bring to birth, especially if you have specific use cases to consider or specific aspects of your pregnancy that are important to consider. So, this is not medical advice. Definitely consult with your physician. So, like I said, one more reminder that you can get the Anja Health kit at anjahealth.com. And additionally, if you like this video, remember to like and subscribe because we're going to be posting a lot more pregnancy oriented content. So, be sure to look at all of our other videos for helpful resources to think about throughout pregnancy and birth. And make sure to share it with your pregnant friends.